Hello, hi guys. We're feeling fresh. We're looking good. Today, Botshilu Private Hospital. Dr. Njinga. She's a hematologist. For you to know who a hematologist is, dilaga ing, kotsa ing. Relax. Otlo iti today. Naloena. Artsana kamahari. Rilo ituta. Rizuruboloka. This is Connekt Media. I'm Sbu Ndengese. Let's go. Hello, hi guys, it's Sbu Ndengese here. It's yet another beautiful day, and today, Botshilu Private Hospital, we're tackling health issues, man. Today, Nale, our special doctor, she's a hematologist. So I'm just gonna give her a chance to introduce herself. How are you, doctor?
Hi, I'm good and you, Sbu.
No, not right, man. Hey, I give maybe if you like blessed all the time. He get the mobile to mobile. Pam fadi doctor te pila man. So like I know I buy senior. Pam feel or the profession te dia ka pila or.
No, not really.
Not really.
Not really, yeah.
Okay.
It's just that we take care of ourselves.
Oh, so it's all about taking care of yourself.
Yeah.
No, that's nice. Please introduce yourself to our viewers. Dr. Kimang, and where are you from?
Okay, thank you. Okay, so in Tswana or in English, everything.
Tswana,
Okay,
Zulu,
libitso laka ke nna Tebogo. The same name is Njinga. I'm a doctor, I'm a hematologist. Basically, hematology, I'm a trained specialist that specializes in blood disorders and other conditions as well. So I'm working in private. I work for the lab, Empath Laboratory.
Okay.
So yeah, that's me.
All right. Now, before Dumbela Moditabe, this profession, I can't never So I always ask this question because Hekin Sekenahana puts or market mo life in decide le ho dietsa haya go skolong a decide na le podisa wa tlhalwanya decide na lawyer. So why did you choose this profession?
Okay, yeah, very interesting question. Hey, hematology I loved it from the beginning when I was in med school.
Okay.
Because ho diagnose blood malignancies, blood cancers.
Okay.
Not only blood cancers, clots,
okay.
And also anemias and mostly cancers. So you get to see a cancer cell under a microscope. So I loved it. I found it very interesting.
So Dr. Radamadi?
Not really. I'm not a vampire. But yeah, it's hematology. You get to do everything in the office, where you're not in front of patients and everything. And it's good to make a diagnosis and see someone get treatment. Yeah, diagnosis really ngwena.
Yeah,
it's very interesting, and it's very broad as well.
Okay, already dumbetse and Okay, we say
bleeding disorders.
Okay.
Yeah.
Now taba ash. Hemophilia. What is that?
Hemophilia.
What is hemophilia?
So since a Hemophilia Awareness Month this month, hemophilia, we are in layman's terms so that the community can understand. Because if you go deep into medical terms, it will be difficult for us to understand.
Yes.
Yeah. So hemophilia is a congenital meaning you're born with it.
Okay.
And then it's a bleeding disorder, meaning you are bleeder. Okay. And then you wanted to ask something?
Yeah, before we
yes,
doctor, what bleeder kokai?
I'll tell you later on where you're bleeding.
All right.
Okay, so it's a congenital bleeding disorder.
Yeah.
And mostly we see it in boys. So yes, I will explain later why is it more common in boys. So with patients with hemophilia, they are missing the factors. The clotting factors.
Okay.
So the clotting factors they thusha madi gore a clote. So ka hemophilia they have these factors that are missing in their blood.
Okay.
Hence, they tend to bleed very easily. So we have hemophilia A, we have hemophilia B. So ka hemophilia A, factor 8 is missing.
Okay.
And then ka hemophilia B, factor 9 is missing. That will be diagnosed obviously in the lab or ke hemophilia A or ke hemophilia B. Okay.
Yeah, no, this is interesting and
Very.
scary at the same time. You know, ke tshosa fela ke taba hore emo. So when you say boys, ora bana
Male in
or
general.
banna le nna ke le o mokana, doctor?
It's yeah, male in general. I'll explain to you why is it more common in male or why is it seen in male. So it's an X-linked, we call it an X-linked disorder, meaning chromosome X.
Okay.
So banna, because they have XY, if you look your mom was a carrier, ke re basadi re na le XX,
Okay.
right? Banna ke XY. So if your mom is a carrier, yeah, the hemophilia on her X chromosome, and then she gives it to you, and then your dad gives you the Y chromosome. So XY, you have hemophilia. So
Okay.
male are hemophiliacs, and then the females become carriers. Do you understand?
Yeah, no, I understand.
Yeah.
So now, can females be affected by hemophilia or e lebeletse batho ba banna fela?
Okay, coming to that,
Yes.
hemophilia, as I said, it's an X-linked disorder.
Yeah.
Okay, males will be affected, females will be carriers. But that doesn't mean female can't have hemophilia.
Okay.
How does that happen? It happens if you are a female and then you are a carrier, and then your dad, your mom, say your mom is a
Yeah.
female carrier,
Okay.
and then your dad has hemophilia, and then how about a female child? Their child will have hemophilia. You get what I'm saying?
Okay.
Do you understand?
Yes.
That X chromosome that is affected from
Yeah.
the dad, plus the one that the mom is carrying, which is abnormal, will cause the female child XX to have hemophilia. Okay, that's one possibility. The other possibility is that as a carrier, as a female carrier or hemophilia,
Yeah.
you have that abnormal X that is carrying the abnormal gene, the
Yeah.
one that is missing factor 8 or factor 9. And then your other X chromosome, it's non-functional or it's missing. Then you start presenting with, you have hemophilia as well.
Wow. So, how can someone recognize the signs or symptoms of hemophilia?
Okay, before we go to the signs and symptoms of hemophilia, I wanted
Okay.
to explain how you can get hemophilia.
Okay,
So as I
yes.
said, it's congenital, meaning you can
Yes.
be born with it, right? I agree your mom is a carrier, you are a man, you get the hemophilia.
Yes.
Secondly, it can be the mutations. Mutation is like changing genes that can occur before you are born. So your mom was never a carrier, your dad didn't have any hemophilia, but it just happened that, genetically,
Yeah.
your genes changed, and then you ended up having that abnormal gene. We call it mutation. Or you can get it as an acquired phenomena. So acquired phenomena, it's like at your age, you never had hemophilia. I never had hemophilia at my age. But all of a sudden, the autoimmune diseases, Autoimmune diseases are diseases that are fighting your own bodies, like this was recognizing your body as foreign. So you get autoimmune diseases, and then the fight that factor 8 or factor 9. So we call it acquired hemophilia. So those are the way it can be transmitted, or the way you can get hemophilia.
Okay.
Okay.
So, double signs and symptoms.
Yes. So with signs and symptoms, how would you, when would you start suspecting hemophilia? So say a mom is pregnant, she didn't know she was a carrier, and then all of a sudden, once she gives birth,
Yeah.
ngwana o kry-a atla a na le hematoma, we call it hematoma, like blood on the head,
Oh.
or following a traumatic delivery, ngwana o ba le di funny bruises.
Okay.
Like when they're still young. The mom didn't know she was a carrier, right? Or a child, an infant, is busy playing, and then you know how rough we are, maybe, all of a sudden, anale bruises all over, so they bruise, can have gum bleeds, nose bleeds, and then joints bleeds mostly. So it cover the elbow, it cover the knee joints, it cover the ankle joints, or they can bleed into muscle, or they can have serious bleeds where they have CNS bleeds, like in your bleeding into your skull or your brain, or abdominal.
All right,
Bleeds.
sorry guys, as I always say this, ne? Gore ge utlwa ho na le noise ko morao. Re mo Botshilu Private Hospital, so obviously the patients, the doctor, ba ya ko dimolokofatse ba spana, ba tlhokometse maphelo a batho. So yeah, ska makatsa ke noise we utlwang ko morao. Okay, so what about that, doctor? Ke re ho na le noise, so ke re ke
That is fine.
Yeah,
So I can continue with
you
the.
can continue, doctor.
Okay, so mostly it will be in a family history. O tlo ba o na le family history ya gore papa hao o tshwenya ke nana le some bleeding disorders previously.
Yeah.
That is very important to know that. And then how o kry-e le gore o bruiser easily, man. You know bruises. Like o kry-e le gore you have blackish around your skin. I don't know if patients understand when I say bruising. And then okra the spontaneous bleeds into joints.
Yeah.
Spontaneous meaning it wasn't caused by any trauma. It just happens all of a sudden how to how onale the joints are how they are painful, they are stiff, you are unable to walk. And all of a sudden how you go toilet willow road that onali hematuria, like there's blood in your blood in your urine. You know, it's all about blood.
Okay.
Or when you go to the loo, you're pooing a bit of blood. So obviously you need to consult a doctor to investigate for what is the cause of your bleeding.
Yeah, Doctor Yatsusa,
It's-
and
yeah.
it also brings me to this question where e dangerous bo kanankang e ka o bolaya.
Yes, as I said, where they get serious bleeds,
Okay.
you know, like they bleed into the head, they bleed into the GIT, they bleed into the muscles.
Yeah.
You know, if that is not treated, obviously you can die. So, yeah.
Yeah, guys, wa bona re tshwereng ka jeko ya le nna e ntshabisa ona madi a re bolelang ka o.
The other thing that I wanted to add,
Yes, doctor.
when can you recognize these kids? You
Yes.
know, in our culture, rira circumcision, you know,
Yes.
like our boys. So the mom didn't know she was a carrier. And then
Okay.
we someone for circumcision, and then half it like where the child bleeds non-stop, where she utloka medical intervention.
Yeah.
So yeah, it can happen like that. Or sometimes it's by rekira mo elong gore ngwana o thoma go walk, you know, learning to walk, they will fall and try to gore ba emelle. Then ha emella mo o kry-e le gore joint all of a sudden e rurugile, which is not expected, you know, in a normal child. So that's where you must start worrying about, does this child have a bleeding disorder or, you know, things
So
like those.
e ka khosa bohole nyana bo boitseng so.
Yes, true. So remember with repeated bleeding.
Yeah.
Repeated bleeding into the same joint. That's what happened to them. So before Kiyamo,
Yes.
hemophilia, according to international thrombotic standard of...
Hey.
Okay.
Yeah, no.
According to...
No, it's fine, doctor.
Okay,
It's
no,
fine.
sorry.
No, don't worry. It's fine.
Yes, according to the standard Serdi Berekisang, you
Yeah.
know, it's an international one, by classify into mild, moderate, and severe.
Okay.
So gore o bleeda bokakang go dependa gore o na le a mild hemophilia,
Okay.
moderate or severe. And then how would you know gore you have mild? Go lab. Re tlo check and check your factor 8, depending gore ke factor 8 or ke factor 9.
Yeah.
Meaning ke hemophilia A or ke hemophilia B, right? So go lab re tlo check the level of the factor to
Yeah.
classify you as mild hemophilia, and then or moderate or severe. So baba na leng severe hemophilia, factor level ya bona like it's less than 1% of the expected normal.
Okay.
So bao ke ba ilong gore like, you know, you just sitting or baba le spontaneous bleeding. And then the moderate one and the mild one ke ba ilong gore they bleed too much post surgery or ge ba fetsa go ntsha meno, you know, like dental extraction, they bleed a lot after surgery.
Doctor ke tlhapa meno mo skin a le ho tswa madi, so Dr. Bonso Sagano.
No, that's I'm sure that's a different thing. You know,
Oh, it's a different thing.
It's probably a different thing. If it's not severe, obviously you need to consult your dentist to see if you
Oh, okay.
level there,
Yeah.
and then your dentist will guide you further. Or is this infection to the gums because maybe you're not seeing dentists frequently, or
Yeah.
you're not cleaning the teeth, or you're not using the correct toothbrush, maybe.
Let's pause a bit, doctor. Yeah,
Okay.
there's too much noise. Guys, let's take a break and we're coming back. I hope you're learning. So, look at the noise. We're coming back. Connekt Media. Thank you. Welcome back to the show, guys. This is Connekt Media podcast and Botshilu Private Hospital. Today, Ribuaka Hemophilia. So, doctor, let's continue. All right. Another question.
Yes.
Is there a specific diagnostic test for hemophilia, and what steps are involved in diagnosis process?
Okay, so once you as a parent or you as a patient or recognize that you have signs of bleeding,
Yeah.
any bleeding, obviously you need to consult a doctor.
Okay.
It might not be hemophilia, it might be other bleeding disorders.
Okay.
Because the bleeding disorders, they are inherited, like hemophilia, and they are acquired, meaning you get them, which is not the topic of the day. So
Yeah.
once you recognize that you have those signs of bleeding, whether it's bruising, whether it's gums, whether it's nosebleeds, whether it's joint bleeds, or when you pee, you realize that your pee has a bit of blood, you need to consult a doctor, which I'm sure they are available at Botshilu Hospital, where they can assist you by doing certain tests. And likely to answer your question, yes, there is a test to diagnose hemophilia. So in the lab, because I'm working in the lab,
Yes.
we do screening tests for all patients ba re bona hanang gore ba na le bleeding disorders. Okay. So the screening test I won't go too much into details because
Yes.
this is for patients.
Yes.
We check your platelet count, we check your prothrombin time, your APTT, your thrombin time, and your fibrinogen. I'm not going to go too much into that.
This is what I always say, guys. Google, ho utlwa gore o message something le nna ha di a ntabola tse ding tse ke utlweletse mara ne ke a utlwa gore di story di a ntabola. So berekisa Google so that you understand gore di terms tse bolelang ka tsona ho bolela ka eng. You can continue, doctor.
Yes, to continue. So, okay,
Yeah.
as I've said, we're going to do screening tests because not all bleeding disorders are hemophilias.
Yes.
So we're going to do steps. And then once really your prothrombin time and your activated partial thrombin time, and then the abnormal, then read the factor assays. So with factor assays, which factor is missing, which factor is deficient. If you look at factor 8 that is missing, then we know you have hemophilia A. And then if you look at factor 9 that is missing, then we know you have hemophilia B. And then other factors that could be, it's not hemophilia, but you have bleeding disorders, like your vitamin K dependent coagulation factor deficiencies. But I'm not gonna go into that. But basically we do factors and then we check which one is missing, and then so we can be able to diagnose it. And family history as well, it will guide, or your dad was a bleeder before.
Yeah.
So it will help us in getting to the diagnosis.
So before Kalebala, it's not here. Before Kalebala, honale, but by long hore, banal problem ya, utsomokolo kort. Leona ikatswa ele one ya, ikatswa ele design it's ayona hemophilia, or there is something else.
You know what? With nosebleeds,
Yeah.
how we normally approach it, Rena, as hematologists, is that it's either bothata ke platelets. So the platelets ke dilo tse di causang madi gore a clote,
Yes.
which is produced by your bone marrow. So we look at your platelet count, and then if your platelet count is normal, we check out are they functioning very well by doing a test that we call PFA 200. So it's either it's platelet,
Yes.
Or is it coagulation factors like what we're talking about now? Or is it the vessels like bothata ka di vessels ka mo dinkong,
Okay.
which obviously will require an ENT. So you can't just see a patient
What is an ENT?
ENT, ear, nose and throat specialist. Sorry.
Hey.
Sorry.
No, it's fine.
Yeah,
We're
so,
learning.
So you can't just see a patient with nose bleeding and say you have hemophilia.
Oh,
As I
yeah.
said, once you start to notice or you have bleeding symptoms, you need to consult a doctor. As I said, they are available I'm sure here at Botshilu Hospital. So you need to consult so that they can work you up thoroughly, do several tests so that they find what is the cause of your nosebleed.
So, doctor, you have to wait to see something, or okaya nje for checkup nje. Not even only for hemophilia. Who know ya fella ono check just to be sure where everything is in order now. And again, ke age effing, especially since elemo baneng too much. Ke age effing e right e long hore motho aka thoma ho etsa di checkups ka yona.
Okay, very important question.
Yeah.
So if you look at you weren't diagnosed at an early age, as I said, remember I said a newborn,
Yes.
for hemophilia, you would see, signs of bruising and everything.
Okay.
So how you look at you were never diagnosed at an early age, depending on is the hemophilia mild,
Sorry.
moderate or severe,
Yeah.
right? So if it is mild, probably you won't bleed, okay, escape until maybe woman 16, where you start to be involved in contact sports.
Okay.
So you start playing rugby, it's contact sports,
wrestling,
and then wrestling,
yeah.
all of those kind of sports.
Yeah.
And then that's where maybe you can, start to notice. But if you look at severe hemophilia, we would have picked it up from an early age. Yeah.
Okay. Now, problem re kreile, and then we understand hore problem e ya tshosa, problem e boima.
Yes, it is.
Now, doctor, cure e teng na or hona le hope ya hore cure e ka ba teng if I teng?
A very important question again.
Yes.
So hemophilia is a lifelong bleeding disorder, unfortunately, meaning there's no cure. But
Okay, ke rata
yes,
but.
but there is a way in which we can stop,
Okay.
the frequencies that they're bleeding, meaning we can give you prophylaxis.
Yeah.
Prophylaxis is like giving you the factor that is missing in your
Okay.
blood. We give it to prevent you from bleeding further, or we give you the factor on demand. We call it on demand, meaning when you bleed,
Yeah.
we will replace a factor A. So the most important thing now at the moment in South Africa is prophylaxis,
Okay.
meaning we give you factor depending on otle monthly, even if you're not bleeding, so that they prevent the hore oska bleeder. Your factor level even at a certain percentage, so that oska ba le di spontaneous bleeds. Because remember when I said what I said earlier on, hore if you're getting the spontaneous bleeds, di feletsa di damage the joints.
Yeah.
O feletsa o na le arthropathy of the joint. So yes, there is some treatment that we use to prevent or to stop bleeding if you are bleeding at that moment for consultation. I'm not going to go too much into the drugs and what we give, but
Yeah.
once you realize that you have hemophilia or diagnose it, or the doctor has diagnosed you with hemophilia,
Yeah.
it's a multidisciplinary it requires multidisciplinary care. By that, I'm trying to say, gore ha e hloke doctor fela, or the hematologist fela.
Yes.
E hloka a nurse, who's going to be your primary contact. O tlo felang a phone and check how are you doing. Are you bleeding frequently? A fela a go fa education. If you're having any questions. Educations like what? RISE. We call it RISE. RICE.
Oh, ne ke re raise.
No, not RISE, sorry. So RISE meaning how bleeder when you are at home. What are the measures that you can do before you get to the hospital? The R, rest that bleeding into you. The I, use ice, the C, compression, and then elevate that limb before ufita go spetlele.
Yeah.
So you need a nurse, and then you need a physiotherapist. Physiotherapist otlo dirang gore that joint is kind of stiff, to help you cope,
Okay.
Yeah. So, and then you also need doctors, obviously, to help you with pain management and all of those. And then orthopedic surgeons as well. So it's a multidisciplinary kind of an approach to treatment. And then obviously the hematologist or the clinical hematologist will be the one who's going to be providing you with treatment. And again, I will decide on which treatment is relevant to your scenario, because not all hemophilias are classified as the same. Remember, I said there's mild, moderate, and severe. Yeah.
Okay, so batho ba bantši ke sure gore ne ba sa itse ka yona, and a se hantši maybe o kry-a le gore go na le batho ba e leng gore ba bua ka yona. So go na le the groups or educational maybe pamphlets no yana tse bjao tse e leng gore a di teng, and batho ba ka di kry-a kae if e le gore they want to know more about it.
Hemophilia.
Yes.
Okay. Before I forget this point, once you've been diagnosed with hemophilia,
Yes.
normally they give you a bracelet or something, so that we apara mo letsohong, with the contact details. It's the center where you're getting treatment,
Yeah.
the severity of the disease, so that you faint, or something.
Oh.
Someone,
Oh,
they
ba
might,
simple
it's easy to identify this patient has hemophilia, So coming to your question on educating the community.
Yes.
So we have I think it's about, in the public sector, I think there's about 22 hemophilia centers.
Okay.
It's mostly in the tertiary hospitals where there's hemophilia centers. But in all the hospitals, if you go, you can even go to the lab and just ask for a pamphlet about hemophilia, because I'm a hematologist, I deal with hemophilia. So we do have pamphlets, and we do have a lab here at Botshilu Hospital. So a patient can walk in and ask for information about hemophilia. We do have pamphlets to give out about the relevant information.
Now, doctor, yeah, wa re ntse re bolela bjana dilo tse dintši di tla mo tlhaloganyong yaka, and ke sure someone ko hae no wa iputsisa gore mara bjanong dileng e ke a e utlwa and ke a e understand. Go na le dijo tse e leng gore di khethehile tse e leng gore tshwanetse o je tsona, or e affecta le diet ya hao ka tsela e itseng na, and then ke eng se e leng gore wa tshwana o seje, ke eng se e leng gore tshwanetse o seje, or dijo ona mo di dumbelang mo teng, you can just eat anything.
With diet, it's important to eat healthy, everyone. But with hemophilia, I don't think there's any food that you shouldn't eat.
Okay.
The most important thing that I almost forgot to mention is over-the-counter medication.
Oh, yes.
Over-the-counter medication like your aspirin, you walk into a pharmacist, or bleeding, the joints are very painful, obviously. You go there, aspirin too much. So aspirin kira dispirin.
Yeah, dispirin,
so
yes.
dispirin is an anti-platelet, meaning it against the platelet. Remember I told you about platelets earlier on. So it means if you are taking aspirin as a pain medication during one of your bleeding episodes.
Yeah.
And then other drugs like your non-steroidal anti-inflammatories, brufen, you must avoid those. So it's better to show advice from a medical team that deals with hemophilia as to what to avoid and what not to avoid. And hemophilia people, if you have that multidisciplinary kind of an approach,
yes,
it affects their quality of life. Imagine having the joints, dinale arthropathy. They are stiff. It means you can't participate in sports. But you can still do sports in hemophilia. The non-contact sports, you can swim. You can play golf. So if you're not getting treatment properly or correctly, or at the right time, or continue to bleed into the joints, the joints gets damaged, and obviously you can't participate into non-contact sports as well.
Doctor, ntho e etsa gore ke batle go nna deep, because ke utlwa bolela ka di join o bolela ka go nna stiffy, and now I'm sitting here and I'm thinking gore re plana go etsa ngwana kona re planang go etsa ngwana, or vele ke boshiu ke nako le re tshwanetse re tshware thapelo ya batho ba baholo. So e ka se ntirele flopo mara if e le gore di-join a di bereke pila o kry-a bjanong bošio re palela ko o tshwara thapelo palela ko etsa halleluja hosana doctor.
Okay, to answer. Okay, to answer that, if you look
Yeah.
at that multidisciplinary approach that I told you about, physiotherapy, you
Yes.
know, like you training your joints and everything.
Yeah.
I don't have hemophilia.
Yeah.
I don't know how they feel. But
Okay.
how that multidisciplinary you know, approach where you get physiotherapy every now and then,
Yeah.
I'm sure it can help. I'm sure it
Oh.
can help. But hona le ba e leng gore already they have gone past, you know, like already banally joined. I'm not sure how that works. Unfortunately, sorry, I can't answer you. But there are so many ways, obviously, for dira thapelo ya boshihu than to, even if you're having joint stiffness. I'm not gonna go into that. It's not the topic of today. But I get it, maybe the video is not only watched by adults, kids are also gonna watch this. So it's a topic for another day. I'm just saying, if you look at moto onale bohole bo witseng, like you can imagine someone who look amputated. But there's so that's what I'm trying to
Okay, no, I understand. Now, doctor, especially with us black people, if ke kopana le tšhomi ya ke I'm like esho itse keng man mo ke bona go ruile nyana ke bona o ka re madi a eme mo ke bona eng re na le doctor tse leng gore a di ya sekolong, they don't even qualify, they're not even qualified.
Dr. Google.
Yeah, ebile Dr. Google ka mmona o betere ola o botsa gore no tseya letswai o le tlhakantshe le eng o etseng o tlo ba grant. You understand? So that becomes a problem because o kry le gore whatever condition e leng gore motho o mo yona e ba worse. So what advice can you give to our community out there, you know, to avoid such things? So if you look at a problem, you see something, say long maybe you feel like say right, and it got the symptoms hemophilia, hore ba consult. You understand?
Yes.
Because re butsa bo makelwane o butsa mang ara nna se le ka tswa eng and I tsamaisana le ntwe wena yo tlhetseng. You understand, doctor? So I don't know what can you
as you know, in South Africa or everywhere where we have different beliefs. Some people believe in dingaka, as in like sangomas,
Yeah.
and then some people believe in medical field.
they believe in prayer only.
In prayer, yes, in prayer only. So me as a trained hematologist, I was trained obviously for if you look or you have symptoms,
Yes.
you must go consult. So if you look you have certain you're not in a way explainer.
Yes.
I would advise them to go consult. Look at clinicking, just go consult, but look at their basic bloods, you know, a full blood count, but check if your platelets are not low, and then they will do a coagulation profile, but check those PT, APTT that I was telling you about. Basic bloods, a basic screening test, just to see, you know, it's nothing related to coagulation factor deficiencies.
Okay, no, doctor. Yeah, I learned a lot today, and I think today is not the last time rebale conversation. Maybe next time re kopana re tla be re tsenela deep mo tsona ditabatse, you know. But before I let you go, maybe someone ya consulta, maybe ona le symptoms nyana or feel hore ba o kra ko kae, are you on social media? Ke hopola go mathomong o boletse hore ko kae, but maybe can you also maybe repeat and tell them hore ba itse ko kae. If you also on social media, you can also tell them hore.
Okay. So if anyone asks Hokaho consultant, I'm a hematologist.
Yes.
He lab based, meaning I don't treat patients. So I'm working in the private sector. So Kiberekela Lab Empath Laboratory, and I'm based in Rustenburg lab. I'm not on social media, unfortunately. But I can give out the lab contact details where people can find me. So the the number where you can contact us at the lab, Eribiriki Sampo Empath Laboratory, you can contact us at 012-678-1000, and then they will put you through to the relevant department.
So, doctor, you're not on social media for consult. You're on social media for your personal?
That's WhatsApp only.
WhatsApp? How na Facebook? How na Instagram?
No, I don't
How
have,
na
sorry.
TikTok? Yana?
No, I don't.
BBM? Yana?
No, I don't.
Hey,
Sorry,
doctor.
I'm not there.
But yeah, doctor, thank you so much for your time. Yeah, I really learned a lot, and there's so many things that I'm tshwanetse le nna ko nna ke di check khona gore ke be sure ka nna gore ke alright na ga ke nyaka ka ra ko ntlong re ba le flop wa bona. But yeah, thank you so much, doctor. Continue doing what you're doing.
Thank you.
And as I said, I say la bofelo re kopana re sa tla kopana hape.
Thank you for having me.
Your last words to our viewers, or you good?
I'm good. The only thing that I would advise the viewers, if you are experiencing any signs of bleeding, be it
Yes.
nose bleed, be it gum bleed, joint bleeds, or any spontaneous bleeds or bleeding into momorotongo, please go consult a GP or come to Botshilu Hospital. There are doctors here, and they will definitely make a right diagnosis and lead you to the relevant department to get proper treatment.
All right. No, thank you so much, doctor.
You're welcome.
Guys, thank you so much for watching, and I believe you learned a lot today. I mean, re tsa dilo light, you know, so rona go tleng mo ha rona go etsa gore wena o itse gore flop o kopanang le yona mo life ke eng and ke eng e leng gore o tshwanetse o etse. My name is Sbu Ndengese, and this is Connekt Media podcast. A re kopane hape tsatsi le leng. Hey, ke ska lebala. Today I'm dressed by Viction Kacho. So thank you for dressing me, Bathong. Thank you so much for watching. A re kopaneng hape tsatsi le leng. Oh yeah.
Thank you.